Up next here, Homeland Security Secretary Janet Napolitano says she's ordered only passive surveillance to stop the spread of swine flu from Mexico. And President Obama says this outbreak is not a cause for alarm. We'll examine what this administration has done and has not done about this outbreak in Mexico. President Obama today trying to reassure Americans the federal government has a clear plan to deal with swine flu. President Obama said the outbreak is not a cause for alarm, as he put it, but he did acknowledge that swine flu is a cause for concern. Ed Henry has our report from the White House.
From the president on down, the Obama administration is moving quickly to calm Americans about a possible pandemic.
And this is obviously a cause for concern and requires a heightened state of alert. But it's not a cause for alarm.
What we're doing is a precaution and not to alarm people.
We don't want people to panic at this point.
But the potential of a public health crisis comes amid glaring holes in the White House's response team after the botched nomination of Tom Daschle as Secretary of Health and Human Services. The second choice, Kathleen Sebelius, is waiting for possible Senate confirmation Tuesday. So a Bush holdover is serving as acting health secretary. And there's an acting director at the Centers for Disease Control, putting the White House in the awkward position this weekend of having health news announced by Homeland Security Secretary Janet Napolitano.
The Department of Health and Human Services will declare today a public health emergency in the United States.
But a prior presidential directive already mandates that Napolitano's department is in charge of coordination on such a crisis. And White House aides note there's no evidence the personnel gaps have backfired.
Our response is in no way hindered or hampered by not having a permanent secretary at HHS right now.
Now, the White House today was also forced to tamp down some speculation about the president's personal health after his visit to Mexico City earlier this month, after a Mexican newspaper reported that someone who had given the president a tour died a day later. In fact, the White House put out a statement late today saying that this man in Mexico actually died a week after his visit with President Obama. They stressed that President Obama's health was never in danger when he was in Mexico City, and that his doctors say he's fine now. Lou?
And with the statement, Ed, that there's no problem, at least in the estimation of White House Press Secretary Robert Gibbs, no Health and Human Services Secretary, also 19 top posts still unfilled, as well as the head of the CDC and the Surgeon General. Who is leading that effort amongst the professionals then, the full-time staff?
Well, there's an acting director at the CDC. There was also acting officials at the Surgeon General's office. Let's not forget, they also don't have a Surgeon General yet. And there's an acting secretary at the Health and Human Services Department. It's actually a former Bush official. It's not even an Obama official, though they do hope that as early as tomorrow, the Senate will finally confirm Kathleen Sebelius, the second choice for Health and Human Services Secretary. All of this, of course, stemming from the Tom Daschle debacle. That really put this White House behind in terms of getting a health secretary in place, and obviously right now it's something that they wish they certainly had. Luke.
And we should point out that Kathleen Sebelius' confirmation held up and challenged on the basis of her positions on abortion. And there is, in your judgment, a likelihood that that confirmation will proceed?
You're right that conservatives have largely held it up because of her views on abortion. There's an expectation in talking to both Democrats and Republicans on the Hill that her confirmation is very likely, at least, as early as tomorrow. Certainly this crisis is likely to push that along, Lou.
All right. Thank you very much. Ed Henry from the White House.